practitioner, and then comedian, thought leader. No, I'm just kidding.
Yeah.
Yeah. All right. We are live this hour with Neda. She is a comedian. Well, I met her as a comedian, but she's also a nurse practitioner. Doing some interesting workshop leading right now. She can tell us more about that. But before we get started with that, Neda, can you tell us how you got into to the world of being a nurse practitioner? We're gonna do a little background first, and then get into.
Yeah, no problem. So see, I'm Iranian. So typically when you're an Iranian kid, you're taught either doctor, lawyer, engineer. So when I was 16 and I had the opportunity to volunteer in a hospital, I was like, okay, 16, this is what I need to do to become doctor one day. Right? That was just like, I was just hardwired for that. But then when I started volunteering in the hospital and I saw what nurses did, well, first of all, unless you've been sick, your understanding of a nurse, unfortunately, a lot of times is like you take the doctor's orders. You clean the patients and everything. It's you're kind of taught that it's more of a helper position, which is fine. We still need helpers in the hospital. But when I started to like volunteer in the hospital and I was working with nurses, I just started to see that like this, I just felt like this job just fit my personality more. And I just felt myself way more excited about being a nurse and just working. I didn't want to be in school forever either. I wanted to be very hands-on. I wanted to be running the show. And I felt like that's what nurses did. So, I got into nursing. I went to community college first. I was a transfer. I did not start out going to a big university or anything. Saved me a lot of money going to community college. I did my prereqs, transferred in, got into nursing school at UCLA. And I was a labor and delivery nurse for 5 years. And then I was in a hospital with a good union. And the opportunity came up to go back to school at Cal State LA to get my nurse practitioner. Had part of my tuition paid off. So yeah, that was my hustle.
Yeah, UCLA is a pretty demanding program, is it not?
Yes, it's demanding. If I could do it again, though, I would do a Cal State because as much as I loved UCLA, you can get as good of an education at a Cal State and as much clinical experience like half the cost. If I could do it again, I would have gone to a Cal State immediately. I went to UCLA. As much as I loved UCLA, that was the school with the prestige, and that's why I went there. But after going to a Cal State to continue my education, Cal States are just as good.
Yeah. So I mean, like to be a doctor or engineer or doctor, engineer, architect. I mean, those are all kind of prestige jobs, right?
Yeah.
So it seems like a lot of like and what they have in common is that they're prestigious jobs. I mean, they're not like unified in any kind of way. But like so obviously you mentioned that you are being kind of pressured by your parents at an early age to do things, for a prestigious way. But you're very practical. Like you went to community college. Reflecting back, you're like, man, I should have gone to Cal State LA. I'd have less debt. So, what kind of advice can you give to people who about saving money here, even if they want to pursue like these higher end professions? Like, because I think a lot of people, they go to the 4 years just to have the plaque on the wall, not realizing.
So, biggest advice I could tell you is that when you're saving someone's life, no one gives a shit about what prestigious school you went to. They just care about they just care that you're there to do the job well. Obviously now with hospitals, they do care that you at least have your bachelor's. And even if you got your associates in nursing, it's still fine. If I could do it again, I probably would get the associates in nursing and then just like get into a program that would allow me to get my bachelor's while I'm working, because that's allowed too. But yeah, with the advice I can give as far as trying to people who want to get into the prestigious school, that's all I can say is that like, the bachelor's is important, but when you're there as a nurse or whatever profession you're trying to do, unless you're trying to do a job that requires specific connections like film or something like that, if you're there to do like a hospital work or something, no one cares where you went. They care about how hardworking you are, and they care about how open to learning you are. Because in the hospital, they don't want somebody who's, going to take a lot of pride in what school they came from. But then when there's a situation where they're under a lot of pressure or someone's dying or something like that, they freeze. you know.
So nobody ever reached up from their bed, gasping for air or vomiting or bleeding out their ears and saying like, "Where'd you go to
Yeah.
school?"
Yeah. Yeah, so yeah, like that's true. They the important thing in the hospital is that you know what you're doing and that you are open to being trained.
Yeah. So what type of character traits should people develop if they want to get into like if they may already have within them, but they may want to work on a little bit if they want to become a nurse practitioner?
First thing, okay, so my first year as a nurse was terrible. First of all, now you don't have to have an RN for, you don't have to be a practicing bedside nurse like I was for a few years before you become a nurse practitioner. It's kind of like with PAs as well. Like you don't have to have prior hospital experience. So nurse practitioner is a little bit complicated, but I'll start out with what it takes to be an RN. Is my first year was pretty bad because the work hostility was all there, right? Part of it was because I was coming from UCLA, and I feel like, I was being treated like, who does this bitch think she is coming from UCLA? And I'm just like, I never claimed I was that bitch. Y'all got me wrong. Like, I mean, I never, like, that's a shitty part that comes with going to like sometimes a more prestigious school is that people think that like, you must be stuck up because you went to and I'm just like, no, I never claimed that. I went because that's where the scholarship was at the time, anyway. I think the biggest advice as far as personality traits is don't become like the abusive traits that you were trained under, because the eating your young shit is still alive and well, because it's just like any other work environment where some people feel like because they were thrown into the fire, it's your turn to be thrown into the fire, right? They think that because their traits, their skills came from a hostile environment, that's the only way y'all are going to learn too. So I'm going to become the hostile person, right? It doesn't have to be that way. You could be driven. You could be, you can be very determined at your job without trying to throw other people under. If you have the skills, you don't have to throw other people under. Your skills will speak for themselves.
No, that sounds like wonderful advice. So, I mean, also, I noticed that you have a touch of humor with this. So, a lot of what we're doing for this series is to have like kind of a backstory, and then we'll get into the important stuff in the middle. But and not that the backstories aren't important, but we're trying to gather a lot of oral histories and stuff. So, I'm really interested in how you came into because you and I met at like an open mic where you were doing doing kind of a little bit of stand up. So, how did you get involved in the world of stand up? Like, I know we're taking a little detour here, but how did you get involved in the world of stand up?
Let's see. So Tom, and I know you interviewed him, was having an open mic, and I came out to support him. And he was just like, "Hey, do you want to get on the mic too?" And I'm just like, "Okay." Like people tell me I'm funny. People tell me I tell funny stories, and I'm just like, I'm going to talk about how I worked with a bunch of racist ass nurses in Lancaster. So I gave them a story about how when I first started in Lancaster, I was called in to be the bilingual nurse. And my second language, the language I'm bilingual in is Spanish. So they would call me in and they'd be like, "Hey, Neda, there's this patient that needs translation." And it'd be an Arab patient. And I don't speak Arabic, And this patient would be like talking to me in Arabic, and I would pretend like I knew what they were understanding. And then I'd turn to the nurse and be like, "Yeah, she says she wants a different nurse. She doesn't like you." And And that's the story I told, and everybody thought it was funny. And like I had a rush from that, so I just kept seeking open mics.
Yeah, that I think so. That was the first time you did something that night with that night at Tom's.
Yeah, I don't know if that was the night I met you, but yeah, there was a few years ago when Tom was having his open mics. I went to one of them, and that's how it started.
Yeah. Was that back when Tom had his dreadlocks, the long,
Yes.
long Viking dreadlocks?
Yeah. Yeah, and yeah, so and it's funny. I mean, Tom is one of my best friends now, but I think 6 years ago when we met, it was somebody was trying to set me up with him. And then when I reached out to Tom, And Tom was like, I have a girlfriend. I'm sorry. And he was like, by the way, do you want to come to my open mic? I'm like, like this asshole. I'm like, okay, fine, I'll show up. He's another Muslim dude I should support. And then that's the night I met him, and that's when he was like, do you want to go up? And that's where our friendship started, was him having the audacity to ask me to come to his open mic.
Tom is one of the most quietly audacious people I've ever met. Like he's like really unassuming, like whatever. And I actually after I interviewed him, I talked to him about this like business idea I had. And like Tom, like, you know, sweet-hearted Tom, who who I had a certain idea about, right? And I'm like, okay, well, you know, Tom is this, right? All of a sudden became this killer that I had never met. I was like, he said, well, do you have this together? Do you have that together? Do you have that together? And I thought I was like ruthless and whatever, but like I wear my like shark teeth on my sleeve, right? So people know like who I am when I get in the room. But like Tom, like I'm like, oh shit, like oh my god, like I didn't consider that, you know.
I feel like he could say with a smile on his face, like, I guess you don't want to see your kids tomorrow, then. Like,
yeah. No, he's got a streak. He's got a streak in him. That was quite incredible. So how has like your general sense of humor and your experience as getting up on a stage doing stand up, how has that helped you in dealing with these stressful situations in the workplace?
So I think is when I was more active, like seeking out open mics, a lot of it now is I'm just not as active now because my job is more demanding over time. But anyway, when I was at my most active, what kept me seeking it out was, I think that, like, you know, when these shitty things would happen, I would make it a way to sound entertaining on my own terms, because that's how I would process. You know, and I loved being center of attention. I loved when people would see me, I think they were expecting someone very reserved, and I loved shocking them. You know, not necessarily with shock value. I wouldn't try to be edgy, but like, you know, I would be like, I see some shitty things sometimes, so, you know, I'm going to entertain y'all with them because I have nothing else to do with them, you know. Now things changed when I started going to therapy, like, you know, and I think like that's one of the reasons why I became less active, is because, you know, when at my funniest, I was also going through the hardest time, like personally and professionally, you know, and it's unfortunate, but a lot of comedians struggle with depression and anxiety and shit. And it's like, once that depression and anxiety goes away, I'm just like, where's my creativity? So that's also been a struggle, because, you know, when I started to like heal, and when I started to find a healthy relationship and everything like that, where I was happy, and like, there was a time where I didn't even feel like seeking out any type of open mic, because I'm just like, I don't need to impress any of you assholes. Like, fuck y'all. Like that. That's how I felt. Like,
no, it makes sense. It makes sense. I know I am very much, in many cases, driven by a sense of vengeance. Well, my vengeance is never quenched. You know, I'll just find new enemies. Yeah. No, the story of my life is very much like me doing something and then being like alone at like a motel, 40 miles outside of Cleveland, in some college town, staring out the window, like, you know, thinking of like, you know, who next am I going to prove wrong? You know?
Like, wow, it's lonely and racist out there. Like,
yeah. very much so. So I understand that, though. Like, if I understand that the idea of doing the things that are good for you, negatively impacting your ability to create art.
Yeah, no, yeah. Like the funniest I mean, even with like getting in shape, right? The best times I'd be in shape was after a breakup, because just the pure rage would just make me run so fast. Like,
yeah, that makes sense. That makes total sense. That makes total sense. So, I want to get into what projects you're working on now artistically, but before we do that, I want to really start talking about some more serious things, which is that obviously we're in the middle of a pandemic. You're a nurse practitioner. Can you give us like a before we get into like what people should and shouldn't be doing, what they should and should not know, and or what they should, what is reality, what is fact, what is fiction. Before we get into that, can you just tell us a little bit how you personally are experiencing all this?
So one thing that personally, so I'm not in, because I work in an outpatient clinic now, and because I'm considered a primary provider, I'm not in there dealing with like people who are dying right now. I'm not in the ICU. So my level of risk is a little bit different. But because we're primary, we work primarily with prevention, right? So I see my diabetics, I see my hypertensives and stuff like that. Our focus is mostly on prevention. Now, the way that I'm experiencing firsthand is, I do the COVID testing. I'm in the tent. The people that I think are at risk of it, I test them. So I think what I want people to remember is that, like, there's a reason we have public health, right? If our decisions were not impacting the public, right? Because I'm mostly thinking of the protesters when I'm saying this. I'm mostly thinking of people who don't think they need to comply with wearing a mask or staying at home, and I know things like class and jobs and all this impacts how you could stay at home. Because I know not everybody can, but there are measures that we could take, like wearing a mask and trying to stay home when we think we have symptoms. And even if my point is that I see there's a lot of arguing about personal rights and autonomy, and whether us staying at home and having to modify our life and wear a mask and everything is constitutional. I want people to remember that our choices, health wise, does impact other people, and that's just the nature of that's just the nature of how we live. Otherwise, we don't need public health. We are all a part of public health. Our actions does affect the public, and I think that we've become so individualistic, and we want to experience that individuality so much that we forget about our public responsibility, because technology and so on has made it very easy for us to not remember each other, and for us to think that we don't need each other, and our decisions shouldn't be impacting other people when they do, and we're seeing the consequences right now of people forgetting this.
Yeah, I think all those like libertarian type people in general should be like put on a log and cast adrift into the ocean, so they can so they can be free.
Yeah, libertarian was trendy until this shit happened. I see a whole lot of libertarian people shutting up now. So, because with this kind of shit, it just doesn't work. That mentality just doesn't work.
Yeah, no, you speak of the public health and the public good. I mean, like, I think people really they'll use terms like public health. They don't really consider like what is like the public, like who is the public, right? Like we are the public, and the things do affect other people. And I don't know. I mean, like I'm not a scientist. I'm not in the medical profession. I'm not whatever. But like, it just seems to me that, I mean, it seems to me like some of the stuff that's going on might be like kind of like the same way LA drivers are in the rain. Like since we don't know. Like we do things that are maybe over the top. Maybe some things are necessary. But if we don't know, we don't know. So we just gotta like.
To the credit of LA, I think we are doing better than a lot of other counties. Like our protests or whatever, they tend to be in Huntington. They tend to be in places where they don't understand struggle. I mean, I work in North Hollywood. A majority of my patients are Mexican or Salvadorian. They've lived through epidemics before. So I feel like with the community that I work in, I don't have a problem. The only times that there are problems, it usually has to do with access to care, which I think our clinic does a good job of trying to give testing when needed and assess people and all that. I think we're doing a good job of being active with the community, but I know that my North Hollywood clinic is not always a reflection of everything else going on in LA County. But in general, I think our county is doing okay.
Yeah. Well, we know that we've heard statistically that the coronavirus, because of the shape of the economy, is having a more devastating effect on the African American community, the Latino community, the various communities that make up the Latino community. I'd be like, do you get a sense of that, or is it just your client base is always Mexican and Salvadoran, so it's just like normal?
So it's hard to say, because I think that like with a lot of Mexican and Salvadorian people, I feel like with the so it's hard to say because I'm still in primary. I don't see people when they're at their worst. I'm trying to prevent them from going to at their worst. The problem is that my patients, they're coming in with insurance, right? Even if they're undocumented, they still have some kind of insurance through the county, and I still see them, right? I don't really see people who are not insured, and that unfortunately is that way in the Black community too, is that there's already a disposition to diabetes and hypertension, and that's who is impacting that's who the virus is impacting the most, is people that have other underlying conditions, and those underlying conditions many times happen because of poor access to care.
Right. So we talk about poor access to care, food deserts, cancer alleys, living under smokestacks, so it's like just the whole shape of society is.
Oh yeah, and also it's diet. Sometimes there's patients that I have of all ethnicities that come in, and their diabetes is out of control right now because they're not, like, specifically now because food banks are being affected. They don't have access to a lot of the foods that would help their, because the medication can only go so far, right? They are stressed out. Many of them are not working right now. And so they're eating foods that are most accessible, which is processed. And that's just throwing diabetes out of control, which is a terrible time to do that with coronavirus. So coronavirus we're seeing disparities at their worst right now.
Yeah. With the coronavirus, what should people, let's say you're not sick, but you could get sick and it's everywhere. So right now is a good time to should this thing hit you, you want to have your immune system at its best, right? And you mentioned diet. So what should people what should we be eating right now, to best get ourselves up, or do what we can?
As far as diet, if you're healthy, we still, and again, because this is so new, I can't say the stuff that I'm saying is evidence-based because the studies are still going, right? If you're healthy, the best thing I could think of is at least try to get some cardio in 30 minutes a day. Go for a walk. There's so many YouTube tutorials and everything like that make it so much easier for you to exercise at home. And even having 30 minutes a day of it does make an impact on your immune system. You want to get a lot of vitamin C in. Okay, if you're starting to show any type of symptoms, whether you think it's cold, you want to start taking zinc. Vitamin C and zinc are the two supplements that showing that they might have some impact. I can't say that for certainty though. But we want to be avoiding foods that just the standard junk food. We want to try to avoid that, even though that's the easiest thing. I want to try to avoid fast foods. Want to try to cook at home more. But it puts people in a bind because then people are scared of going to the market too, Yeah.
But not everyone's growing vegetables and fruit in their backyard. So it's just one of those things. So you're saying what we should be doing is taking, or what has been said, and what you're just reaffirming, is that vitamin C and zinc are kind of the supplement things we should be taking to boost our immune system at this time.
Yeah, and obviously if you don't have zinc, that's okay. But if you don't have vitamin C supplement, you want to be eating. And what's funny is that it's raw foods right now in the markets that are in a surplus. So people are going through, people are preparing. Yeah.
I got about 5 of these. in the whatever. That's
yeah.
The minute I heard that, I was like, all right.
Yeah, so that's going to help you in theory. But I think people should be looking into cooking with raw foods more, because that's what's in the surplus in the markets right now, because people are preparing for kind of a doomsday mentality. So they're all taking the packaged stuff. They're taking the soups and stuff, but there's so much that you could be cooking with the raw vegetables and the raw fruits, because that's also going to help us try to decrease our waste, right? Because there's markets that are just throwing out all this fresh food, and that fresh food is what's going to be helping us too.
Yeah. So as a nurse practitioner, I want to ask you something. I've had chronic bronchitis for most of my adult life, and at no point in time did I ever think what I really need is some toilet paper right now.
Yeah.
So, that's a respiratory condition. So why are people acting so irrationally? What do you think, or why do you think?
I think because they don't know what's coming, and I think especially I don't know how it is in other states, but like this is not a state that's ever had to deal with hurricanes or tornadoes or whatever, right? To them, natural disaster all falls under the same umbrella, and that includes pandemic, right? We're preparing for, I mean, when they get all this like toilet paper and all that, like, you know, they're acting like it's the same type of natural disaster as an earthquake or a hurricane or a tornado. We just don't really have much idea of what disaster preparedness looks like, and the coronavirus goes under the same umbrella. So instinct is, I'm not going to live without a clean ass, so I need that toilet paper. Yeah.
Yeah, no, yeah, that makes sense. It's so weird to me though, the things that that are getting hoarded and things are not, like, and like toilet paper, bleach, the little things, the things that go on the bottom of Swiffer.
Yeah.
Yeah, those. But like shampoo is plentiful. So apparently nobody thinks, like when it comes to like the apocalypse, no one needs, dandruff is fine. Like, like there's no,
Yeah.
there's an apocalypse.
Yeah.
I mean, like I got greasy hair. I don't care about that. So like,
I think also another thing that like I've noticed. You remember in middle school or high school when like three people would start running, everybody starts running, and there's a whole mob. I feel like it's the same thing with Costco. Is that like it just took like 10 people to just like hoard on toilet paper, and everybody's just like, oh no, like is there a disaster with toilet paper that I'm not seeing? I need to get some toilet paper too. I really think the whole middle school and high school running mentality never left us. So there's that too.
Yeah, no, I think that's true. I mean, you like notice that when you're at a supermarket, like all of a sudden everyone gets in line, and all of a sudden you're compelled to stop shopping and get in line. You're like, maybe I should get in line. Yeah. Like everyone gets in line at the same time. Yeah, like traffic jams. I mean, there's a whole like weird thing about psychology of traffic jams. But like,
train wrecks too. Yep.
Yeah. So no, that's a good observation that people just got they just whatever. I mean, I know for myself, I had a contact on the inside to industrial shopping to get my toilet paper, and I just boom, took care of it.
Yeah.
I'm not going to the market trying to do that. I'm not fighting people for toilet paper, so I'm gonna use my cunning and my instincts to my underworld connections. No, so what right now? There's a lot of misinformation. There's a lot of disinformation. There's a lot of confusion. What should people know like right now? Like where should people get their updates? Because this is an unfolding situation, right? And in the middle of an unfolding situation, you get lots of different information. So what should people?
I think it's typical, like, you want to be watching out for headlines that sound sensational, that kind of make you feel like you're the one who has to fill in the blank, right? I think that like articles that kind of talk about a lot of uncertainty, right? Like there was one article I was reading about how like, oh no, the flights, it's going to be so much more expensive to fly in a few months because of X, Y, and Z. So let me talk about these hypotheticals. And I'm like, okay, but we're not there yet, right? I think you should pay attention to articles that give you the data now, right? And that are letting you see the numbers. They're not trying to help you draw conclusions from those numbers, right? Mm-hmm. The articles that are trying to help you draw a conclusion, like kind of ask you a question and then let you fill in the blank, I don't have an example on hand, but I think like that's a typical method in propaganda, for example, right? Yeah. It doesn't let you really form your own opinion. It's filled with leading questions. That's what I would be very careful of.
Yeah. Well, I kind of feel like a lot of the stuff was, a lot of stuff we're talking about is perpetrated by like the small time, like kind of clickbait kind of websites.
Yeah.
But like a lot of stuff's been perpetuated by some of the mainstream outlets as well. I mean, talking about like 800,000 people are going to die in Riverside if this doesn't happen, or this, there's been a lot of that from major news outlets as well.
Well, the models still, so when any time in an epidemic, they still do have models, and it is still fair to have projected projected predictions about how many people could die, because it is a common tool in epidemiology, right? So it is fair, but it's only like if it's only really spoken in terms of what's going to happen if we don't have certain social distancing measures in place. Like here's a projected number, right? And I think considering how backed up the hospitals can get very easily, I think they do have to think about worst case. Because the problem is that if you have all these people that were exposed in the public, because coronavirus is community spread, you're going to have people that they're going to be so backed up with coronavirus, the severe cases, that they are not going to be able to take you in if, let's say, you have a burst appendix or you have a heart attack or something like that. It's going to start trickling down and impacting people that don't even have coronavirus, but they still need emergency care. There's a lot of emergencies that exist outside of coronavirus. And, those models are important. But I think if those articles are not offering any type of solution, and is just trying to, scare you like that, then that's when I would start questioning. But I think some numbers are scary, but just because it's scary, that doesn't mean that's what the media is trying to do. It's just this shit is scary. There's not a lot we can say.
Yeah. Well, I just think that there needs to be an if-then proposition in the headline, because a lot of people just read headlines. They don't even read the article. They read the headline. They share it, right? So I remember reading this article someone was sharing. It was like, oh my god, everyone's gonna blah blah blah, right? And then when you actually read the article, it was talking about like some of the active measures that were taken in California and why they were so effective, right? So the actual article tells you like, because we did A, B, and C, C, D, and E are not going to happen, right? But the headline of the article was like, everyone's gonna die, like lock your mom in the basement, like it's for her own good, like that was like the headline,
Well, I think a lot of these headlines are like, because they know, I mean, I'm guilty of the same shit. I don't read half the stuff I post. Coronavirus is different, but like, because it's my job to like stay on top of misinformation and recognizing what kind of misinformation is out there, and also trying to understand what the facts are to get this better under control. But in general, right, I think clickbait articles know that most of the readers are not going to read the entire article, so they have to put some sensational headline and let you make your own conclusions.
Yeah. So working in the medical field, did you know how bad this was going to get? Like, let's say in January and February, when the rest of us were just like sharing memes and articles, like taking like that. Did you know it was going to be this? Because I'm guilty of that. I had I thought this was going to be like when there was Ebola in Dallas and there was like 2 cases and everyone was like, oh my god, and it was like like, doesn't your dad live in Dallas? I'm like, yeah, he lives in Dallas with like 1.5 million other people. Like, I'm not. I thought it was going to be like that. I didn't think it was going to be like this.
Well, I think I feel like I kind of knew shit was going to get bad, but the thing though is that California acted on time. A lot of, and there's even medical professionals that were in denial. There was another doctor that I worked with, and she was trying to reassure everybody, in the break room that like, oh, this is going to be over by May, and I'm just like, it's May. Hello, nothing's over yet. Denial goes even to professionals. Denial is a powerful thing, and professionals are not immune either. So, because I knew that like this virus is spread asymptomatically, and because it's so highly contagious, I was trying to warn a lot of my friends to not go to gatherings and everything like that. But it was like a week after I started, especially religious events and everything like that. Luckily, even in California, like mosques shut down pretty early. I didn't feel like I had to like, tell people the British are coming or whatever. I didn't have to do that, because because California acted very quickly. And even in the religious communities, they shut down a lot of the places of transmission early. So I didn't feel like I had to,
Yeah. And, I know a lot of the resistance to this has come from, I would say like, a lot of the resistance comes from the just general reactionary, whatever, right? So a lot of like the people that are out there marching, like, talking about this isn't don't tread on me types, right?
Yeah.
But there's also been a response from like the religious community, and like, and in the religious community, I mean like various religious communities, kind of like the more like the more, like the more stringent. Like have you seen that a lot, or has it been pretty just
The religious community has been surprising. I mean, I don't know, when I feel like a lot of the religious community that makes headlines is like fundamental Christians or evangelicals, like somewhere in the middle of the country. And, luckily I have not heard anything from like other Muslims in this state, at least. Everybody's like, okay, cool. Everything's shut down. Um, so I mean, and especially with like evangelicals that are like insisting the churches be open and everything like that. Um, at the risk of oversimplifying it, I mean, I don't think it's a surprise that it's in the area where like the Bible Belt is, and where there's a whole lot of people that are Republican, are hardcore Republican, and don't understand how that with rights come responsibility.
Yeah.
And shutting, yeah. Mm-hmm.
I just want to clarify. When I say religious community, I mean like everyone is religious. I mean like that was too broad a term that I just used. I mean more like kind of like the outer edges where it becomes less about religion and more about politics. Like and that kind of more that end where people who are like like I don't want to be told. But you're right. It's mostly white evangelical kind of expressive. Yeah.
Yeah, like in Pebble Beach, like in I think it was Pacific Beach in San Diego. I saw a video of like one of the protests going on there, and it's like people are showing up with crosses and stuff like that. And I'm just like, how is this a religious issue? It's not a religious issue, but it's like, again, like people who like I guess with like colonialism and shit, they see a lot of their religion, in that mentality of like, this has nothing to do with my religion, but I'm still going to bring my religion into this to force this place to open,
Yeah, they're like carrying the crosses like Baskin Robbins. Yeah, that's pretty. That's making a pilgrimage. That's horrible.
Yeah.
Okay. So how has that been? What kind of experience has it been for you? Like kind of migrating. How have you experienced like migrating practice of worship from physical, like being in a mosque, being amongst other people to the internet? Have you been part of that or?
Well, I mean, it's Ramadan right now, so I knew a lot of people. I mean, it's different. It's different that like I'm not going to the mosque after after fasting and everything like that. But the great thing about like being Muslim is that like I mean, the community is great, but that is not something you need for worship. Worshiping alone is very what do you call it? It's highly appreciated among Muslims, is worshiping alone. Of course, it's better to be with other people, but again, like one of the values that we take seriously is that like we don't need other people for a connection to God. The connection to God is always there, and isolation happens.
Yeah. Okay. Sounds good. So moving from that, I have to keep this thing going, and there's no smooth transition.
Oh yeah, no problem.
So like you are now taking your nurse practicing, your comedic thing, and also working out, and combining them all into this new thing. So what's the latest project?
Okay, let me show you it. I will keep this halal, I promise. So let me see if I could set this up here. All right. Let's see. Okay, so there is my pole.
Yeah.
Right here. So I started going to pole class as a joke, okay? Because I was just like, haha, wouldn't it be funny, if like someone like me goes to a pole class. And they were like the most inviting group of people I've ever met. And it was super body positive. And after the first few classes, I stayed because the community was so welcoming and I was getting a very good workout. So I stayed. So so now I don't have comedy available as much anymore, but, I try to do something with like comedy in my tutorials. So, I mean, I'm still kind of a beginner, but for example, the most basic pole move is just going around the world like that. right?
Yeah.
It's a very basic transition. But the way that I would try to teach it, like on Instagram, is I'd be like, okay, we're going to put one foot here and we're going to turn back around and come right back to our X in the same position. Um, because we don't learn from our mistakes. Yeah.
Yeah.
So, you know, that's where I try to still incorporate like some kind of like comedy into it. And I feel like that's where I could also express my creativity. So
like you got kind of like the fireman thing there, but like how do you if people don't have that, is there like how can they replicate that at home, like trying to follow along?
oh, hey, Kitty. You know, there is as far as pole, there's so much conditioning that could be done if you don't have one, right? Because pole uses so much yoga and it uses so much upper body strength and everything. Half the class where I'm at is like it doesn't involve like needing the pole. You know, a lot of it is conditioning away from it. So most people that follow me don't have a pole either. You know, but they still either find what I'm doing inspiring or very funny. So
yeah.
Mm-hmm.
So that's part of making sure you get like your aerobics in and your yeah, that's part of. So again, that ties back to what we were talking about earlier about like making sure to get a certain amount of exercise to boost your immune system at this time.
Yeah.
So yeah, so can you tell us a little more about yeah, can you just like reiterate again like what people should be doing at this time and how can we put ourselves in, I mean, obviously if you get it, you get it, and hopefully
I think the most important thing is, from what I'm seeing, is, you know, is to recognize when you're being in denial, right? Are you reading something because you want it to be true? Or is there some kind of like numbers backing that up, right? Because during this time, as somebody who's been working in healthcare for a long time, it's very easy. I mean, denial is such a powerful thing. I have people that don't take their insulin because they still have not accepted that they have diabetes, for example, right? Because once you start treating it, it becomes a reality. So most important thing that people need to do is that if they are showing any type of respiratory symptom, they cannot just attribute it to allergies, right? They need to be honest with themselves and stay at home, okay? They need to realize that this coronavirus is not just about them. Their health does impact other people too. And it impacts other people that are not able to fight this virus in the same way you can, whether that has to do with access to care or whether they are already immunocompromised, right? People in the public are eventually going to have to make people who are homebound, right? 2/3 of the people that died in New York, they were already at home because they had contact with people that are trying to provide essentials to them while they're at home. And that's how usually they catch it. So I just need people to remember that this goes way beyond them and they have the power to make this situation better for the public as well.
What symptoms should we be on the lookout for?
You want to be on the lookout for something that starts out as a dry, scratchy throat. Okay. A fever. Some people with coronavirus do not have a fever, but fever is the most common one. And as they have like a dry, scratchy throat, if they start to feel very fatigued, like they feel like they don't want to get up. And I know that shares a lot of symptoms with other viruses, right? Like the common cold as well. The problem is that right now we can't take a risk, you know, and even if you are healthy, you still need to wear a mask when you're outside because you can't rely on the public to do the right thing, you know, which is to stay at home when they have symptoms. Because like I said, denial is a very powerful thing.
Yeah. Okay. Great. And where we'll drop the links below. Where can people follow you to get some of these exercise and relationship exercise tips and relationship advice?
So my Instagram is Hijabi Luscious. Yeah, it's at Hijabi Luscious. And then I do also post some of my pole videos on my Facebook as well.
All right. Well, Neda, I really appreciate you taking the time to talk with us, and it's been very informative. And I wish you all the best of luck, and I wish you the best of safety.
All right. Thank you.
All right.
Bye.